Well, good morning. I think we're going to have a fun panel here today. We've got a great list of panelists and a great topic to play with. So let me start. My name is Dave Whitlinger. I'm the Executive Director of the New York eHealth Collaborative. I formerly was with Intel, helped form the Continua Health Alliance, spent a bit of time playing around in the telehealth, telemedicine space. Most recently with the New York eHealth Collaborative, we're the public-private partnership. So we are the organization responsible for implementing healthcare IT across the state of New York. We're one of those organizations that receives the meaningful use support to distribute out across the state. And for that, we're also recognizing gaps in the healthcare IT software industry. And I hope to share some of those gaps with you today as we go through this panel. We're actually going to be stimulating a fund in New York here later this year, or starting up a fund later this year that tries to address some of those gaps. So we'll talk about that in a few minutes. But with that, let me ask Brian to introduce himself.
Thanks, Dave. My name is Brian Dolan. I'm the editor and co-founder of an industry publication called MobiHealthNews. I've been around since late 2008, focused on mobile health. Recent audience data up to about 65,000 uniques a month. So clearly the interest in mobile health has grown quite a bit in the last couple of years. And yeah, happy to be here.
Thanks, Brian. How about Bill?
Hi, I'm Bill Geary. I'm a partner at a venture capital firm called Northbridge Venture Partners. We're early stage investors. We started our firm about 17 years ago. We've made investments in a little over 180 companies over those 17 years. Have an active portfolio of about 80 of them today. And one of our prime areas of focus is healthcare. So healthcare software, communications, and materials. If you add it all up, we've got about $3 billion under management in total, 7 different venture funds. We like to start early, and so early for us might mean a small check, 50,000, 100, 200,000, around 1 or 2 entrepreneurs, some of whom might sit in our office. And we're active, helpful investors in terms of building a management team, introducing those early companies to potential partners, customers, and the like. And I know that some of our investments are out in the audience. I'm happy to say a number of others have been around today. A new one was actually part of the panel just earlier in the Statler room. A new health technology company called Healthrageous. But I'm happy to talk about the portfolio companies as we go, but that's what we do.
Very good. Scott?
All right, yes, that's me. I'm Scott Kirsner. I write a column and a blog for the Boston Globe called Innovation Economy, just covering whatever I find interesting right now in the startup and venture capital and larger company world in New England. I have a book. My most recent book is called Fans, Friends, and Followers, and it's all about how individual people, mostly kind of in the arts and creative worlds, use social media to make a living and kind of build up an online reputation. There's still one copy of it, I think, left at the bookstore that I saw on the way in, and I'm going to be crushed if it's still there on the way out. So just someone take pity on me and buy that last copy. It's not selling quite as well as the Checklist Manifesto. And the other thing I'd mention is I helped start and kind of help run a conference on Cape Cod and also in San Francisco called the Convergence Forum. And it kind of looks at how healthcare IT and mobile apps and biotech and medical devices and the pharma industries are all increasingly working together and trying to tackle the same problems in hopefully more coordinated, not less coordinated ways. So thanks for inviting me to be on this panel, whoever did.
Very good. Halle?
Hi, I'm Halle Tecco, the founder and managing director of a nonprofit called Rock Health, which I actually founded when I was living here in Boston at Harvard Business School. I was interning at Apple, working at the App Store, covering the medical and health apps, and recognized that the level of creativity and innovation in my sector that I was covering wasn't as nearly as robust as the woman who sat next to me and covered games, or the gentleman who covered even news. And so I thought that there was a huge opportunity to really push what we call integrative innovation, which is the idea of bringing everyone to the table to solve some of the biggest problems out of the box. So we really believe in bringing together hospitals, payers, and technologists and business people to look at the problem from all angles and build solutions. I guess, sorry, I didn't even talk about Rock Health, but we're a seed accelerator actually in San Francisco right now. We provide grants, office space, mentorship, and connections to our hospital partners, which range from Harvard Medical School to Mayo Clinic to UCSF. And we're actually just wrapping up our first program, and we're going to have about a dozen startups graduating in November.
Very good. So I'd like to try a little audience participation to get started. How many entrepreneurs do we have in the audience? Oh, wow. Okay, that's a lot more. How many of you are past the first round or into that still pre-revenue, but first? Oh, good. How many VCs do we have in the room? Stand up. VCs, stand up. VCs, stand up. We're going to do a little matchmaking here. All right. Well, and so obviously there's a lot of excitement in this space. All the venture capital organizations that we've spoken to in the last year are seeing a tremendous influx of companies and a lot of ideas. People want to help solve healthcare problems. It's amazing the amount of fervor that we see here.
What about like healthcare providers or healthcare industry people who aren't entrepreneurs or VCs?
Oh, customers. We want customers? No, there's an idea. Do we have patients and customers? Customers. That's some. Good. Okay, so here's a first question for the panel. A couple of years ago, on one of the iPhone launches, it was an infamous iPhone launch for the medical device industry, because up there on stage with our good friend Steve was the iPhone. Plugged into it was a glucose meter and a really great glucose diabetic app. Haven't seen it since. Any ideas why? Where is that product? How come that hasn't become mainstream for diabetics everywhere? Where is the diabetic iPhone, the diabetic Android, the diabetic, what's that company up in Redmond? The other one. Where are those things?
Sonny is right here, the founder of
developed that
Agamatrix. He's killing it, actually. So.
No, he left the company and he's running the AV at this conference now. So I don't know. No, I think the answer is like they partnered with Big Pharma and it's maybe been slowly wending its way to market. That's sort of the answer. Slowly, fastidiously, in a regulated way, wending its way to market.
So I think the presentation you're referring to was the Johnson & Johnson company. Mm-hmm. And Apple actually approached them about 6 weeks before the event and said, we got this great idea. We think we could sync up your glucose meter to our iPhone. You got 6 weeks, put it together. And so the company said, sure, that'd be great. Publicity, we know we can do that. We'll give it a shot. And they did. So they put together a prototype. And I think what unfortunately happened, as it does at these Apple events, it got a little carried away and people started to think of it as an actual product offering. But in reality, yeah, it was just a prototype, and I think there was a bit of a falling out afterwards. We covered that story pretty extensively, followed up with the company. They made very clear, no, that was just a prototype, bit of a misunderstanding. And I'm not so sure that the two companies really worked very closely together after that.
But there was a fervor for that device, right?
My understanding is that the Agamatrix one, which Sanofi is marketing, is that true? Yeah. Is like the first medical device approved to work with the iPhone, and it got to market earlier this year. People could buy it? So it's in 10 countries and launched in Europe in March.
So, but right after that, there was obviously consumer demand. There was a lot of fervor from diabetics everywhere that wanted that. That's what they were looking for. Why is it still not ubiquitous? What are the market barriers that you're seeing that have not caused that to be an explosion? It was obviously consumer and customer demand for the product, but it's still not here in our hands as we would think of it. It's making its way, but it's not as ubiquitous as one would think.
Let me add one thing. I think that a lot of these early consumer health apps are just that. They're very early. They may be niche-y. They work okay, but not great. But from my point of view, I think that's totally fine. I mean, we may feel like we've been talking about consumer health technology for 10 years in this group. But the fact is, we've really just begun. We're at the absolute starting line, in my view, with regard to consumer health technologies, and so I think we have to be careful not to think about consumer health technology as potentially interesting, but also potentially niche-y apps that plug into your iPhone. There's just so much more than that to it, and from my point of view, I'm a little bit of a libertarian in this regard, and I know that doesn't play well in Massachusetts, but when I think back to kind of the 40s and what happened with healthcare at that time, and some people may know the story or may not, but essentially unions negotiated that employers, this was at a time of wage freezes, that employers pick up the cost of their health insurance. And from my point of view, that was probably one of the absolute worst things that could have ever happened with regard to the consumerization of healthcare. Because all of a sudden, we were not consumers of healthcare with our own money. It was someone else. It was the employer. And that just, I think, changed everything. And so what we're trying to undo now is all instances of that, because we're trying to take what otherwise should be consumerized and never has been and make it that. And so sure, there'll be some products that will lead a revolution that will plug into an iPhone, but it's so much broader than that, I think, what needs to be undone, and the mentality that needs to be undone with regard to providing health care, devices, diagnostics, and everything else along the way in order to engage consumers and make people feel a responsible part of their own health care.
So it sounds like what you're saying is that consumers, for the most part, have handed that responsibility over to the healthcare system, and for them to become part of, become a consumer again instead of just a patient, something has to change. What do you see as being a forcing function in the environment that we have now that might cause that change?
Well, I think, quite frankly, the environment today seems so scrambled on so many fronts, but I think that's a good thing. I mean, people are uncertain about the uncertainty, and so on the one hand, that's bad, but quite frankly, I think that's good, because when all the puzzle pieces are pulled apart with regard to healthcare, I do think that that'll enable consumers to grab control of their own dollars, of their own lifestyle choices, of their own solutions. And so from my point of view, I actually think the ground is probably most fertile now as a result.
Scott, do you have an opinion?
You know, I do, but it's borrowed from somebody else on this. Frank Moss, who some of you may know, ran the MIT Media Lab until earlier this year, and he uses this analogy. He talks about patient-centric health. And, you know, it's the idea that, you know, Bill was sort of talking about in the olden days, like we were all responsible for, you know, writing checks to the doctor, and really, you know, kind of no one had our data unless we wrote it down in a notebook, you know, about, you know, how we were feeling, or, sort of illnesses that we had regularly. And so Frank talks about the PC revolution in the 80s, when suddenly consumers decided, like, hey, they actually wanted these PCs in their den to, you know, play games or manage their recipes, or, you know, keep books for a home-based business. And suddenly there was such a groundswell of, you know, of excitement of software development for the PC, that businesses and kind of the infrastructure of business really had to take notice, and IBM woke up to it, and DEC and every other big company that had kind of poo-pooed, you know, the potential of PCs kind of had to get with the times. And so Frank talks about maybe the patient-centric healthcare revolution happening the same way, where, you know, you have people using their mobile phones or using Facebook to manage their health in ways that initially seem kind of insignificant, you know, measuring your blood glucose level, you know, tracking, as eHealth does, you know, tracking your migraines or tracking some other kind of chronic disease. And suddenly, like, that data that we control starts to get interesting enough and useful enough that it maybe forces the healthcare system to kind of come in line with, you know, with what consumers are doing. And I really like that model, and I think, you know, being a Boston-centric person, I like the idea that there's so much happening in Boston, both this conference and a lot of app development and website development, that you could say, you know, hey, Boston was the, you know, was the spark, you know, was the place where many of the sparks flew in the last revolution, and, you know, sparks are starting to happen in this next revolution.
So it sounds like, Scott, you're thinking the innovation that's occurring now with all the great technology, much the same way that the PC industry led computers out of the mainframe era, that perhaps that will lead patients into the consumer era of healthcare.
I do, and, you know, just one other thought is that, like, no one is excited by what's happening in the electronic medical record world. You know, there are all these incentives, and people are sort of kicking and screaming and adopting it because they have to, and, like, that's not a revolution. Like, you know, it's not a that's more like, you know, the British Empire, you know, in the, you know, early part of the 18th century. You know, people are just dragooned to work on, you know, you have to scrub the decks on an old warship. Like, no one likes it. And I think that revolutions happen because people get excited and they get fired up. And like that's what you see, like when someone is losing weight with Lose It, or, managing their diabetes in a new way, and they're excited and they tell other people. That's how revolutions start, not because they're complaining at Mass General about some software that someone's forcing them to use.
So Halle, you must have some interesting companies that are going to try to grab this.
Yeah, so just to actually add on to what Scott's saying, I think there are three things that we're seeing, everyone's seeing, that's changing, that's going to help the consumerification of healthcare, and I think that would be a lot of the regulation that's starting to crystallize. So just the unknown for entrepreneurs is really tough, and until recently, the FDA didn't even have out guidelines that were really geared towards helping entrepreneurs understand what was a medical app and what wasn't. So I think that whole conversation is starting to make more sense to entrepreneurs who are now more willing to take risks and build some of these products. I think reimbursement's another huge thing, and some of the insurers are being quite open-minded about what they want to reimburse. And then I think the third biggest piece really is lowering costs, especially around sensors. And I think there's a huge opportunity for the sensors to become mass-produced and commodities. And as their prices lower, as battery life gets stronger, we're seeing really neat ways that we can track our health. And I think there's a growing, and we saw this on the last talk here, there's a growing quantified self movement that's still considered early adopters today, but if we take on the PC analogy, we know that could eventually become a mass market.
So, Bill, are you of the belief that the patient becomes the consumer because of all the innovation that's happening, or is the underlying payment system still broken?
Well, I am a believer in that, but I do want to say one other thing, just picking up, Scott, on your comment about EMRs, and they seem kind of an unsexy component of the plumbing. The fact is, they really are at the heart of a component of this revolution, and that's the informatics and analytics. And so if you know all of your healthcare data and you're able to review that, edit that, analyze that, even on your own, never mind all the informatics and analytics companies that are going to do that and provide that data to pharma and provide that data to hospital systems, that actually is part of the revolution. So I actually think that EMRs are a really important component of that. But in the end, there's no question in my mind that the consumer has to and wants to drive this wave in healthcare. Just no question.
So Brian, now that consumers have a handheld that's much more powerful than the mainframe that we're referring to, what's on the horizon that you see?
Well, I mean, I'd agree with all that's said so far. 100 million smartphones in the U.S. now, according to CTIA, most recent survey. More and more people have these devices. One of the things we do is we track how many health apps are actually out there in these app stores. Weeding through, there's a lot of noise. So it's up to about 9,000 consumer health apps in the App Store for Apple users. And just based on this pulse check we've been doing every 6 months, we expect 13,000 next summer. So tons of options out there for consumers who are interested in these things. But I think the next phase of that, as Halle mentioned, comes back to the regulations. And now that the FDA has made clear, at least their intention to regulate some of these different apps, there's going to be really two classes of apps emerging, of those that are regulated and those that are not. And those medical device apps that are regulated as such by the FDA, I think are now going to help drive some adoption, because now providers are going to be more comfortable prescribing or recommending use of these applications, because they know that they've gone through a certain quality control process. And that leaves probably more than 10,000 apps next year that may be sticky consumer apps that are more fitness oriented. But I think that regulation actually might help on the healthcare side of it.
So are providers actually going to engage with that? There's always been this void between them not being able to trust or be able to use the data created by the consumer, because they don't have control over how that data came and what how it was created. Are they really going to pick up on that data in those devices and engage with the consumer, or are they still going to keep it at arm's distance?
Well, I think some doctors are already doing that, but as Gary Wolf said in the last session, it's really mostly potential right now, and there is, I think, a lot of pushback from providers. But applications like WellDoc already integrating with EMRs, already working very closely with the provider community. So there are signs of very high quality healthcare apps out there already, mobile-based ones on the chronic condition management side, that already working within the system.
I was just going to mention, like, just to differ a little bit is, I think Apple is so great at marketing, and, they run all these, ads on the back cover of magazines, where they're listing all the latest cool apps for the iPhone, that I think, people forget about the power of Facebook, and just how much more viral people doing things on Facebook is than people downloading an app. And, first of all, like, the most popular app on the iPhone, and I think the Android, and I think the BlackBerry is the Facebook app, right? So if you're developing some new mobile health app, it can be really hard to get momentum in whether you're in the Android store or the iPhone store, just because there's so much other stuff there. And when people download your app, there's nothing that automatically tells all of your friends or tells all of your contacts, hey, so-and-so just downloaded, the new asthma management app from Partners Healthcare or whatever. And so I think for people working in this space to forget about Facebook and developing apps and developing, games and software in the Facebook environment is just kind of silly, because Facebook is so good at saying, whatever, so-and-so just, has been 17 days without an asthma attack using the asthma management app. It's so good at spreading information and kind of bringing new people in to a system.
I also think self-reported data is really at the heart of it. So many providers are afraid to empower the consumer totally, and that's just a huge mistake. We're generally all pretty smart. We're generally well aware of what's happening in our own health and to our own bodies. And so self-reported data is a critical part of it. It's not the only part. And so in my point of view, it has to be added to data from other sources. And so whether that's multiple devices and kind of integrating device data, self-reported data, so maybe in a mobile and online app like from our investment Health Regis, where you're then as a consumer able to access and work with all that information, the providers will trust it a little more so. But back to the FDA comment, I actually think Occupy Wall Street is completely off base. It needs to be Occupy the FDA. I am not an FDA fan at all. And as soon as I hear that the FDA is nosing around this, I think it's perhaps one of the single most misdirected things I could ever hear. It's a big mistake. In my judgment, to invite them into this space, I think we need to resist it violently.
So regulation stifles innovation?
Regulation stifles innovation.
But uncertainty is worse. So not knowing if they're going to regulate or not, that was our feedback a year ago from entrepreneurs, and we surveyed 100 of them. And the biggest concern was not being sure what was going to happen, and so were they going to spend their resources and time building something that would be shut down? This summer, we actually did a follow-up survey with 110 early-stage entrepreneurs, and regulation was actually the maybe four of their biggest concerns of what they said were the biggest barriers for entrepreneurs. The first being funding, finding VCs that will actually make smaller bets. So, Bill, I should introduce you to some of our startups. Talent acquisition was another big one, and really regulation was not as concerning, which I thought was interesting. But I would like to add a quick comment to the conversation about getting the providers involved. And I think that we're going to see different types of providers getting involved. And so one of our teams at Rock Health is called CellScope, and they've built a plug-in for smartphones that sits over the camera and turns the device into an at-home ear infection diagnostic. And that image is actually sent to a teledoctor, wherever he or she may be, and they can actually diagnose if that's an ear infection or not from home for about $10. The device is $3. It's a commodity now. And instead of going into the doctor's office, which may be $200. So thinking about the providers that are getting involved in these apps and sensors, there's an advantage to actually displace some of the more traditional, inefficient modes of diagnosis.
So is that a medical device today or not?
It is a medical device, and they're going through the process of
So they're crawling through the regulation. Is anybody here from the FDA? Not going to self-describe today, right? So what about then the physicians, though, that are worried about this data that comes from unknown places because it's not in their control? Now they're worried about the liability. They're worried about getting sued. And presumably that's what the FDA there is to help with as well, is that you have some level of confidence in the data that you're getting because there's a regulation and an environment there that's created to help with that. Is the payment system going to shift in order to release that tension with providers being able to use this data, such they're empowered to look at it and they're rewarded for doing that? And is the liability of looking at that data and perhaps where that data came from always going to be a barrier for them?
I think when you talk to the bigger tech companies involved in embedding wireless in some of these systems, some of these medical devices, I'd say one of the quotes of this year has been, if you don't have wireless enabled in your medical device, that's going to be seen as more of a liability 5-10 years from now than having it. The idea that less connectivity is a good thing, not knowing is better than not knowing, it's going to shift the other way. So I kind of like that idea of inverting liability from the way it is today versus the way it might be, but yeah.
Let's see. What is the next killer app in your own individual minds that is going to actually catalyze consumers or patients to become consumers? What's the one, Scott?
That's going to turn patients are consumers, right? So
they're willing to pay for it.
That's going to get people excited.
Yep.
I don't know, Halle mentioned kind of cheap sensors, and I'm not sure if Gary Wolf touched on Green Goose, the company that started here in Providence and Boston and is now out in San Francisco. But, their idea is if you could have stick-on sensors that you could put on anything, that people could decide where you'd want to put a sensor. Like, do you want to put one on your bike that keeps track of how many days a week do you take your bike out for a ride and how long do you ride it? Or you could put it on your kid's toothbrush and find out how many times a day are they brushing their teeth, or put it on the dental floss. So I love that idea of, if sensors were $5 and, you could have a web.
Or the liquor cabinet.
What's that?
Or the liquor cabinet.
Right. Could you have a dashboard of, where all these sensors exist? When was the last time your treadmill was turned on, that sort of thing. So I think that's really cool. And then, I can't rattle off a lot of examples, but I just think there's going to be better health-related games developed that will kind of, there's so much potential in games on the iPad or your laptop or your mobile phone that you're going to play to, stave off Alzheimer's or to, improve your reflexes when you're playing a game of tennis. And I just don't think we've seen, we haven't seen the Zynga or the Angry Birds of that space yet that really, kind of matches the creativity and fun with the health or neurological benefit.
So Wii was a flash in the pan?
No, I think it's like a step along the way to some stuff that will be really cool, where instead of just playing Angry Birds to waste time, you're going to play Angry Birds to, keep your mental acuity, high as you age.
Brian, what's the killer app?
Well, today the only real adoption is around some of these fitness apps and fitness devices. That's really a lot of the buzz is. I agree, gaming, I think that's kind of becoming one of the most popular things to talk about in healthcare, gamification. There was a great session on that here yesterday. But yeah, I'd go with fitness in terms of what's looked like the killer app to date. But again, that's very much a select group of people that want to track their runs and track their exercising. Yeah.
It's kind of a niche. Halle?
I think Bill and I might be a little biased towards our portfolios. So I'll just kind of say some themes that I'm excited about. I'm really interested in how design can improve usability and get more people excited about using whatever health products are in their lives. I think that's probably the biggest movement is on the front end is building things that people actually want to use and seeing really great design firms like IDEO build out really robust health and wellness practices to address the fact that most healthcare products are kind of ugly. And then I think in the back end, just really bringing in talented developers that can build scalable products that are, will work and are reliable. So
the only other thing I'll add, this is maybe going up a level. This is principally about lowering healthcare costs and allowing the consumer to take control of his or her own health interactions and health experiences. And so if you think about all of the 98% of your physician interactions, you should be able to do yourself on your own devices in the comfort of your own home and have that data and that information simply be transmitted and part of your information record. And if that is achieved, and I think that's the path that we're on, healthcare costs will be dramatically lowered, and people will feel empowered, lives improved, and they'll be healthier as a result. So this really is about, I think, empowering the consumer, promoting healthy lifestyles, having people take control of their own health. But I'm not exaggerating when I say 98% of the reason why each of us goes to a doctor or postpones going to a doctor. Those are the things that we should be able to do at home, and whether it's devices, sensors, mobile apps, online apps, other great interfaces that enable all that, it's the sum of all that that really is the most powerful, I think.
So let's say that we're not able to change the responsibility in the environment, and that people still rely on the healthcare system to take care of them. And to your previous point, Bill, let's say the insurance plans then are the ones that are going to be the ones that are really engaging in consumers. Are they the ones that are going to have the brand out there that engages consumers with these hot products? Is it going to be the United Health Plan iPhone app that really wins the day as far as ubiquity?
I think the insurance plans don't know it yet, but they love this movement. They love it. They're not even sure what business they're in today, quite frankly, for all the reasons that we all know. And so this movement is really at the core of what's going to define, I think, new payment models and new business models for insurance companies.
So all those entrepreneurs that are out there coming up with killer apps, are they all ultimately not going to get bought up by the Facebooks and Googles and the Yahoos? They're going to get bought up by the Uniteds and the WellPoints?
I'd like to chime in here. I don't think they'll be purchased by them, but I think we're seeing the insurers actually making investments. We've had a few teams that have gotten term sheets from insurers, and VCs don't really know if they want to co-invest with insurers, but it's sure exciting to see them wanting to put their money behind an idea they think can scale, which the insurers that we've talked to are more interested in helping spur the ecosystem than really manage these apps themselves. Although some of them actually want to turn into IT companies. Was it Aetna that said they want to be an IT company, not an insurer?
I was just thinking, not to, everyone lauds Apple, but, the scheduling experience, if you ever need to go to the Genius Bar at an Apple store, is something you can do entirely online. You can see what the appointments are that are available, you pick a time. If you need to change it, you just go back and you change the time to something else. And if you think about how much energy, labor, and cost could be taken out of the system, just if you said to every doctor's office, like, you don't do scheduling anymore. Scheduling is purely app-based or web-based. Like, how much...
Like ZocDoc.
Yeah. Like, how much cost would that free up? And if there could be some incentives to say, like, hey, this is a red time. If you take an appointment during this time, you may be sitting around longer than, the green time at 8 in the morning or whatever.
Yeah. So insurance plans definitely have a horse in this race. Yeah.
I think they're a critical component of it. I really do.
Yeah, particularly if the consumer doesn't decide to reach into their own pocket. That's where it's going to come from. How about behavioral change? That's always the sweet spot of, if we're going to try to address the 20% of the population that's the 80% spend, everybody believes bending that cost curve requires behavioral change. Ubiquity of all these mobile devices presumably allows for that. What innovations have you seen that might actually cause that something in that regard to be the killer app?
I'll add one thing. There's a real art form in behavioral change, and so I think a lot of people don't understand it and really don't get it right in applications, but there is an art form there. And so I know I've mentioned Health Rages before. I won't mention them again. I just mentioned them. But that is an area of specialization that I think is a really important component of all these applications, because it not only has to be fun, and people think about games as an interesting analogy, but you've got to be able to sustain that behavior change over not just 3 months or 6 months, but over the course of your lifetime. I mean, you have to have that kind of relationship with your medical information, however it's derived, right? And so I think behavior change is a really, really important piece of it.
Halle?
I heard recently of a program that was using a mobile health program that was incentivizing individuals, I believe it was in Africa, through, it was all incentives through minutes on their phone. And I thought, we should do that here. I think that's a really great idea. Because I think
run a mile and get a minute?
So I don't really know much about behavior change, but I'm sure incentivized by free stuff. So I imagine other people are too.
Yeah, I think gaming is sort of where everyone goes with this when you bring up behavior change right now. That's sort of the superficial answer right now. I think that in some cases it helps. It could lead to better engagement, but I think a lot of the work coming out of the MIT Media Lab, which we've seen some presentations on here, just some of this sensing of emotions, a lot of new work. I think, new tactics, new strategies that should come out in a couple of years are going to come out of that research.
Scott?
Well, I don't know. I think free stuff and gamification may play a role, but I actually think, when you look at what has driven like the insane growth of Facebook, it's been about sharing stuff with, groups of friends and groups of colleagues. And so I think there's huge amounts of potential in, the stuff that, HIPAA is built to prevent, right? Which is like publishing and sharing information among groups of people, and to say like, all right, if you live in Cambridge and there are other people who are managing, congestive heart failure, here is a group that you can join. And Patients Like Me is sort of in this space, right, of creating online communities of people suffering from the same diseases or conditions. And so, I think what really is going to drive behavioral change is some kind of clustering, if you think about like LinkedIn groups or groups on Facebook or groups, communities on Patients Like Me, of people saying, hey, here's an app I've just discovered, or here's a new device, or here's a new drug. And, that's what behavior change is going to be about, is kind of being part of a small, maybe geographical group that, might get together in real time every once in a while, but kind of primarily exists online, and kind of having people in the same way that a Weight Watchers group or an AA group, helps encourage you to keep on it. I think there's just huge potential there.
Mm-hmm. So now with this last round of iPhones, and certainly with Apple and its dominance in a lot of the conversations, video is now becoming very dominant on all these devices. Is video now going to become that technology that helps save healthcare? Is it being able to connect a clinician, care manager, physician, anytime, anywhere? Is that going to be the killer app?
So is telemedicine really here? Is this really the time? Is that
it's in our hands. Is it going to get used?
Anyone in the audience involved in any telemedicine applications or products?
A few. Okay, we've got a few minutes left. I'd like to ask for any parting words, then I'm going to do another audience participation. Scott?
Well, I don't know. I mean, on that question, I would like to, first of all, I'm interested to hear from the audience, like, are there some apps that we should know about or services that we should know about that are particularly interesting in this, at this juncture of everything we've been talking about? On the video front, I mean, it seems like, logically, rather than trying to, would 5-minute long consults with your doctor over the, every month for 6 months be more valuable than the one, half-hour consult that you get and that you sit around and wait for in the office for an hour and a half? Like, I would tend to say yes. Like, I would love those 5-minute consults and less frequent office visits. But, I don't know if that's true across the entire marketplace.
Brian?
Yeah, I think we've touched on it a bit. I think bringing the providers into this conversation, getting consumer apps that somehow enable you to better interact with your physician. These are the apps that maybe have the toughest road to follow to get there, but I think that's really what a lot of consumers are looking for.
Any video apps in your portfolio, Halle?
Yeah, we have a fitness team, Skimble, that's created personal workout videos, and they're #1 in the Android Health right now, and they just launched this summer, so we're really excited for them. But I would like to say, kind of one last piece for me is that, there is a lot of uncertainty around the business models and who pays and regulation, and there's a lot of skepticism in the space, and I would just encourage all of you to be really supportive of people who are trying new things. There's a lot of negativity for kind of newcomers and new thinkers, especially from the tech world, that they don't know enough about healthcare and they don't know what they're getting into. So I would just really encourage all of you, from whatever your background is, to be very proactive and maybe help them kind of think through some of these problems, because we need experimentation. And even if a lot of these ideas fail, we're going to learn a lot. So I think let's make sure that healthcare is really supportive of these new ideas.
Bill?
Well, and I'll just add, we're active healthcare technology investors and certainly big believers in it. So from early stage through, even more mature companies, and are making a significant commitment to it, and think the opportunity is really, really quite large.
Okay, so back to the number of entrepreneurs we have in the room. How many, if you'd like, you get an opportunity now to give your nickel elevator pitch. We'll cut you off, it's too long. Gong show rules apply. Got to be consumer focused. Who would like to start? Right here. Stand up.
First of all, I agree with Bill's comment. Behavioral engineering, behavior change, very important. I was a student of B.F. Skinner, probably the best part of my Harvard education. We're not doing the right thing when we jiggle, alarm, SMS, text. We need to reinforce it. Second, it's nice to be a doctor occasionally and know what really makes a difference. An app has to be actionable. It would be great to know when a Parkinson patient is tremorous or dyskinetic and when he's frozen. That would help me adjust his medicines. It would be great if I could look at his medicines, which is what my device does, and adjust them. It's not particularly useful to have a huge amount of information, afferents, coming into a doctor's office. Every 5 minutes I stuff my finger into an oximeter that's linked to a phone. There is an app like that, all right? It's not actionable. And I think those are the apps that fail. So the apps have to make medical sense. Weight gain, congestive heart failure. I know how to adjust the meds. I know how to look at them and make sure they were adjusted right. That's useful.
So what's your killer app?
What's the device you were talking about that's Parkinson's related?
The device is a very simple idea. It's an accelerometer that tells the difference between Michael J. Fox on TV, who's dyskinetic, which happens at the beginning of L-DOPA dosing, and someone who's frozen, who absolutely feels he can't move.
Yep.
And that's the way we adjust Cinemed and all these other drugs. We usually do it in an office by asking a husband or wife, what is your spouse going through? And it's a very inaccurate history. That history would be extremely useful. Knowing that, again, I want to make it brief, congestive heart failure, when people start gaining weight, water is being retained by the body. I know a diuretic has to be increased. And the device I built looks at the medicines, ensures that the right change in dose was made, and people are then taking it.
Good. Thank you. Another killer app. Here we go.
Hi, I'm Jacqueline Tong. I'm the CEO and founder of eHealth. Thanks very much, Scott, for the earlier quick shout out. eHealth helps patients be able to manage their chronic conditions by providing them with really simple, easy-to-use tools focused around a specific disease condition. Our first application out has been live for just over a year, and it helps migraine sufferers track the frequency and duration of their migraine, understand how their treatment and triggers are affecting their migraine, and overall help them find patterns. So we are essentially a quantified health company that helps people figure out the patterns in their lives so they can try to eliminate those triggers and make positive lifestyle changes.
Thank you. Next one.
Tara Kuzno, founder of BodyMojo.com for teenagers, that's BODIMOJO. And we have web and mobile health apps for teenagers. We're trying to make health cool. I'm really excited for this conference. We're really interested in Facebook with this age group. We've done a lot of usability, user experience design research, and we know with teenagers, you got to touch their emotion. The numbers, the diet, calorie counting, fitness counters really don't matter. It's how they care about themselves, their bodies, and what their friends think about them. So I think that BodyMojo can really leverage all of that. So send your teenagers to it now. We need to get members.
That's
And are
great.
you based in Boston or somewhere else?
Cambridge Innovation Center.
Right here next to the column.
Lois Draven, I'm a digital global consultant, and I represent Tecco, which you've probably read about recently. It's the Greater New York Hospital Association Ventures. I'm a senior advisor to them. We are actually looking for apps to include on Tecco, which is a fully curated platform for use by hospitals. They have sub-scores, they have a global score. I'd like to explain it. Anybody can come up to me. I'm specifically looking for, we're an affiliate of Apple, and we've curated every Apple application on the healthcare professional side into 60+ categories. I'm specifically looking for Android, BlackBerry, Windows, web-based browser apps to put into the store to be available to hospitals. We have 10 beta, 11 beta hospitals right now, and we're moving forward with more other kinds of solutions for hospitals in the network.
Fantastic.
Seek me out.
That's great stuff in New York. Who else? Up here?
I come from Portugal.
Very good. We'll do two more. Back there.
MobiHealthNews, we've developed technology for people with dementia. We have a passive system where we can monitor the individual. We put that through software. It's embedded with technical algorithms. And we, in less than 0.3 of a second, can send messages, alerts, and alarms back to the care staff, both in a care home environment and in a domestic environment at a very low cost, but ultimately providing empowerment to the resident who actually is unempowered by doing anything for themselves. That's where we're going. We're just trying to launch it in the US now.
Very good. One more. Dead center.
CEO and founder of Greatest.com, ISP. We try to take things from a different perspective. There are now 9,000 apps doubled by next year. Where are people going to go and where are people going to find that resource that can be trusted? So we're trying to build that through content. So higher quality content that like Live Strong. And we do that by having every fact cited by a content study. We've had every single article by multiple experts and written in a digestible way. So check that out.
Very good. So we did a little bit of speed dating there. Obviously, encourage you to, if you eyeball the VCs that are in the room, you have opportunity later. First, I'd like to applaud all of you that are entrepreneurs that are helping raise the economy and doing it with healthcare. That's awesome.